The FDA has changed its blood donor eligibility and will no longer ban men solely for having sex with other men.
The new policy expands the population of potential donors at a time when blood centers are scrambling to build the blood supply back to pre-pandemic levels. This Pride Month, the FDA is emphatic, however, this will not jeopardize the safety of the blood supply.
It is not a change that anyone is making out of political correctness or what anyone might want to assume. This is strictly a decision based on solid science and research.
But make no mistake, gay and bisexual men donating blood has been a political and social issue, as well as a public health concern for over 40 years.
It was in the 80s, at the height of the AIDS epidemic, men who had had sex with men were banned from donating entirely.
That lifetime ban remained in place for more than 2 decades. The social fear of transmission of HIV or AIDS in the 80s was very real, and the science community was scrambling to understand and contain HIV and AIDS and to ensure the blood supply was safe.
I think at the time when HIV and AIDS first came about, everybody was scared, but I think we've learned a lot more since then.
And the FDA's policy has changed over that time. Initially, men who had sex with men were permanently banned from donating. That had been trimmed to a 3-month deferral. Now the FDA is eliminating time-based restrictions altogether.
There's been blood centers across the country that have taken part in research on this topic to evaluate what risk presented itself for men in committed relationships of freely giving blood. The risk was minuscule.
Gay and bisexual men will now go through the same screening process as all donors, in which eligibility will be based on behavior. The FDA and blood centers maintain the blood supply is safe. All blood donated goes through a strenuous screening process for diseases like HIV. Post-COVID, blood supply has still not returned to pre-pandemic levels. The new policy opens up donations to another portion of the population, which could help restore blood supply to a safe level.
There was an awareness that at a time when donors are needed more than ever, why are we putting unnecessary obstructions in the way of someone who wants to donate?
I think that we have more and more medical practitioners who are very supportive of the LGBTQ plus community. And I think that more and more they are learning in med school how to approach someone differently and maybe be a little bit more open-minded.
Well, we are covering LGBTQ issues and stories this month. You can check out our Pride coverage on WDTN.com. Just click on the News tab.